the main priority is not going to be let me find a primary care doctor so I can go see a cardiologist based on the discharge instructions that I got the other day. Like they're not going to do that. They're going to say, I need a safe place to heal. And oftentimes they don't, so they come back here because of exacerbated symptoms. So there was McDonald's in every 5 mile radius, and it was accessible, it was easy, and it was cheap. And so I didn't learn that I was in a food swamp.
I grew up with a single mom, and whenever we would go to like the hospital or doctor, we always felt lost.
Llanet was able to follow up. We called every single day, making sure he had an appointment. And that's just how we worked together with the team here, as well as helping out in the community once they discharge.
So, hi everyone. Welcome to the Empower Her the Patient podcast. I'm with two guests today, the two community health workers from Torrance Memorial Med Center. Basically, I run this podcast and we highlight the accomplishments, attitudes of women leaders across LA, specifically in the healthcare system. And so today I just wanted to introduce you guys very briefly. You guys are the only team at Torrance Memorial, and you guys are currently advocating for a CHW team by connecting patients to navigate complex healthcare systems by connecting them with resources like housing, food security, and transportation and primary care. And so I'm very glad to have you guys specifically just because this is like a totally different type of vibe. I'm usually talking with physicians or nurses, and this is really great. You guys actually work side by side with patients. And so I just wanted to introduce you guys. They graduated from UCLA and also Charles Drew University, which is a new med school in Watts, California. And let's just get right into the questions. So the first question I have for you guys is, what does advocacy look like in your day-to-day work as a community health worker?
Yes. So, like you said, we do work hand in hand with patients, but also alongside social work teams, case managers, and with physicians as well. So, what we do here currently at Torrance Memorial, we had to identify who would be most vulnerable for lacking or having reduced access to care. So,
Mhm.
we started looking at managed Medi-Cal patients. So, that's patients that have an HMO plan that is affiliated with a Medi-Cal group. So, for example, that's LA Care, that's Blue Shield or Blue Cross, because this is a private institution, they won't be able to follow up with our physicians. So we would identify those patients and make sure at least they're connected to their primary care doctor to get that next step, and also for preventative care. And we do the same role as well. We just are assigned to different parts of the hospital. For example, I'm in the ED and she's in Lundquist, and we just try to help navigate those resources that we could provide.
Yeah, so I guess like my intention with this question is it's just the two of you and then you do work interdisciplinarily with a lot of different teams, but how do you guys manage just the volume of patients that you do identify? Because we're in like a broader safety net population. Some people are coming from Harbor, which is a huge county hospital. So I guess how do you guys deal with like the volume of patients that you do work with?
So, first we start our mornings by looking through all our assigned floors,
Right.
and then we identify the managed Medi-Cal patients who don't have a primary care provider, and we make sure to create a list so we don't forget anyone, we don't leave anyone behind. And
Right.
sometimes when we don't have time and they do discharge, we make sure to follow up with them even if they're discharged. So we still call them, make sure they got connected to primary care. Like today, I was able to call a patient who I provided primary care information to like 2 days ago. He was admitted, but then
Mhm.
he discharged, and I wasn't able to confirm whether the schedule, because he wanted to schedule on his own, due
Okay.
to him being a new patient. Sometimes they do have to consent that first appointment. So unfortunately, I wasn't able to do that for him, but I still made sure to call him. And I was able to confirm until today that he successfully got an appointment.
That's
Yeah,
great. I'm glad
yeah.
that you like, oh sorry,
No
sorry,
worries.
Cassidy.
So
Um,
with that
Yeah, go ahead.
patient, it's not just calling to make sure they have an appointment.
Right.
So during the rounds with the physicians and the case managers and social workers, the plan was for this patient, they need close follow-up because of a new diagnosis of diabetes.
Okay.
So you would need insulin, but you would need a primary care doctor. How do you do that? You need an appointment.
Mm,
So Llanet was able to follow up. We called every single day, making sure he had an appointment. And that's just how we work together with the team here, as well as helping out in the community once they discharge.
that's actually a really great segue into my next question. I was gonna say, like, how is healthcare shifting towards prevention? And that's exactly what you guys are doing. It sounds unfortunately, like not a lot of people want to have your guys' roles because it could sometimes get really tedious too. And so just advocacy work in general, just having to flag down people. A lot of people do get lost to follow up for their appointments, or they just don't really know exactly the full like depth of their condition. And so I really am so glad to know that like just my hometown Torrance like has people like you guys and that you guys actually like were able to do that course through Charles Drew because that's fairly new too. Like that entire school in itself is new. So I guess just deviating from this question, I just wanted to ask you guys like how did you guys ever even come to the community health working field?
It's healthcare is shifting towards prevention because they do understand that it's more upstream care versus just dealing with the symptoms of downstream care.
Exactly. So I guess my question was like, what drew you guys to that field specifically? Because I think it is so necessary at Torrance Memorial too, even though we're a private hospital. Like you're right. Like we need these resources for everyone.
Well, for me, personally, what made me want to get into community work, growing up, I grew up with a single mom, and whenever we would go to like the hospital or doctor, we always felt lost. So I just felt like I needed to step up and help my communities, especially with like language barriers. I feel like
Exactly.
sometimes things get missed because of that. So yeah, I feel like just personally my growing up and seeing family members or family friends, all of that, just being lost with like
Mhm.
healthcare has definitely pushed me to be out there.
No, that's amazing. Cassidy, is there anything you want to add to what Lynette just talked about?
For me personally, I did grow up in Carson and I did have my family with me that helped create access to food at home. However, it wasn't always healthy. You know, there was McDonald's in every 5 mile radius, and it was accessible, it was easy, and it was cheap. And so I didn't learn that I was in a food swamp. I didn't even know what that was until I went to college, and they taught me that it's not right, you know, that other people have better access to healthier foods when other places are fully swamped of unhealthy options. So just learning about how we can shift towards prevention in our own community and our own families as well. I'm like, hey, maybe we shouldn't buy McDonald's today. Like, you don't need that. You don't need that.
That's true.
So so just talking about how we can be healthier at home, it makes a healthier community and we could not rely on symptom management, medication management, and we won't even have to be here. But I think that healthcare is shifting towards prevention through us as well, which is what inspired me to go into a role of community health work.
No, those are really great stories. I think that I could very much relate to. I live in Carson as well, and yeah, it's just so normalized. I didn't really even hear what a food swamp was. Like I was hearing food desert. I believe that is like around the same term too, and like I think that because it's so normalized, like you don't really question your upbringing because it's like your parents who brought you up and like your parents were present and your mom was present and you guys were still under the same roof so you feel like okay like I should be able to respect like what I have and like really be thankful for what I have but beyond thinking besides that I feel like a lot of people don't really realize that there are a lot of upstream things that could really I guess like the decisions that you make when you're younger can really affect like your long-term health too. And so I didn't really know that growing up either. And so I guess that's also a really good segue into the next question. And so Sometimes a patient's most urgent need isn't necessarily medical care, but it's actually housing, food, or transportation. And I think transportation is a huge factor too, because we have like a very big bus system here as well. And so, how do you prioritize those needs that aren't medical needs necessarily, while still helping patients stay connected to their healthcare plans?
This question kind of separates the two of how do we help patients stay connected to healthcare, but also looking at a whole person approach with social aspects. I think that you can't have one or the other. I think having whole person approach to care, you have to look at all factors. For example, if they don't have access to transportation, how are they going to get to their primary care appointments? How are they going to pick up their pharmacy refills? And for housing, that's not the main priority is not going to be let me find a primary care doctor so I can go see a cardiologist based on the discharge instructions that I got the other day. Like they're not going to do that. They're going to say, I need a safe place to heal. And oftentimes they don't. So they come back here because of exacerbated symptoms. And for food, how how does that not correlate to healthcare? You know, they need access to healthy foods instead of trying to figure out when their next meal is going to be. And so, as community health workers, we do actually create and update resources hospital wide as well as for the social work team for discharge paperwork. We create those resources to provide, and Llanet has also worked to make these resources accessible.
Oh, so I was able to translate some, well, our resources that we have, like food banks or like housing, like shelters. I was able to translate them to Spanish because we did notice we were handing these resource lists out to everyone, and then we realized, wait, how are they gonna know what these resources are for if they can't understand what's on that paper? They're gonna see that it's in another language and then they're just gonna throw it aside and yeah, so.
Yeah, so I think what you guys do is great. Can I just ask like how young are you guys? How young are you, Cassidy, Llanet?
Girl, we're young enough.
Yeah,
We're
I
young enough.
know, and
We're old
that's
enough.
so
I
yeah,
think
that's
that
so good to see.
the
There's so many old school people in the South Bay, like I don't know, it's just like really nice to see young people like doing work that's like I don't know, it's gonna help like more people than I feel like you can't really quantify how much you help people if you're also tackling like so many things all at once. Like to get to that appointment, you're talking about getting like the right bus routes for them, getting like the EBT program for them, like all of that stuff, you know, like that's why I ask like how young are you guys? Because
Yeah,
this is
for
really
sure. I think helping an older generation as well, they prefer not to use computers. Like if we're helping them enroll into resources such as Medicare or other social security income, they don't want to do it through the computer. Maybe they don't have one or they're not as savvy using it. So they prefer doing it through the phone or through paper. And sometimes they even fall asleep and they don't finish the application, so we have to do it again the next day and the next day until we're successful. So definitely being tech savvy, especially with the move towards more modernized technology and how that implicates into healthcare, I think it's very important that we're also accidentally leaving people behind culturally because of technology.
mm-hmm.
Yeah, but I don't think that I think there's a lot of community health workers that are in different age groups as well. I think in our cohort, we had many different age groups and different generations that were also helping and can relate more to different generations as well. I think that age can play a part, but I think the most important part is like the dedication to the work and being there for them, building that time relationship. And I think that transcends all the barriers to generations.
No, I definitely agree. I think that because we're tech savvy and we have more patience, oh no, we're not gonna like rage quit or anything like that. I think it's very helpful. But thank you guys so much for your time. And so I just wanted to just go back to your slide real quick. So I also wanted to just say, like, congratulations for starting, I guess, like, reviving pretty much the community health team at Torrance Memorial. And I really I see such a good future with this, and I can totally see like a team of like young people just like working all together. Do you guys have any like expansion plans at all that are like in the works?
I'm sorry, other what?
Expansion plans in the works?
Expansion plans, it's been very difficult to say whether or not it's going to be an established position because we weren't even supposed to be here this long. We were supposed to
Right.
see how we can integrate this new program into an inpatient setting,
Mm,
but
hmm.
we were supposed to be done in August of last year, but they've seen such a difference in how we can contribute to patient outcomes and also to length of stay. And so they've been trying so hard to maintain this as well. But I don't I really hope so. You know, if you look at our Instagram post at Torrance Memorial, I made Keith Hobbs, comment under it, like it, subscribe,
Yes,
everything.
our
So if you
CEO.
check to
That's
see,
so
he says well
funny.
done with a stamp of approval, an emoji of like clapping hands. So he's the one that approves it. So if you're watching this, Keith Hobbs, please, 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 definitely make this a role that can be approved in the future so that further generations can be supported and also be community health workers in the future.
Oh yeah, this is great. Excuse my dog. But thanks guys so much for coming on. That was our sixth episode titled The Role of Community Health Workers in Health Equity. And we pretty much highlighted the community health team at Torrance Memorial Hospital. And please stay tuned for other episodes. We are a podcast highlighting the accomplishments and attitudes of our women changemakers across LA County. And so thank you so much for listening, and we shall see you next time. Bye.